In 1993, when we first did our PG course, we were about 6 homeopaths in Bombay. I was one of them. Though I was in practice for the last 25, 30 years, I just had it. I said, let me take a chance and let me go and do this course. So we went there, we had a fortnight lectures here, then we had a fortnight clinical training there, and we had our exams there, and then we did the PG. So I think we were the first batch that did the PG course after many, many years. In between they stopped, and then they started again in 93. This is not a prepared talk because I'm not a regular lecturer, so I'll just speak about my experiences in cardiac cases, in hypertension, how we can go with the homeopathic management. One thing that we should realize that we are basically consultants and we don't go in really much for general practice. So patients who come to us not as first-hand cases, come to us second-hand, third-hand, fourth-hand cases. They have already gone to a cardiologist, they have already got their reports, and then they come to us because somewhere they feel that down the line, allopathy is not really benefiting them and not doing good to them, and their pressure is either staying high, their pressure is not being controlled, or they have certain complications of hypertension. So invariably they come to homeopathy not to reduce the pressure, but they come because of complications. One of the most common complications is they develop pedal edema, and most of the anti-hypertensive drugs have this notorious side effect of creating edema around the ankles and puffiness, especially coming on in the evenings after they have stood for some time. Another very, very common side effect with most antihypertensives is loss of libido. They create impotency in a very big way. When these patients go and complain to the cardiologist, he tries his various permutations and combinations. He tries different drugs, beta blockers, channel blockers, ACE inhibitors. They have a wide range. There are nearly about 50 to 60 drugs in our market in allopathy for hypertension. Each day a new drug is introduced. They make a big claim, oh, this will cure your blood pressure, there are no side effects. After 1 or 2 weeks, it's given up, something else comes up. So if I look over the last 35, 40 years, the drugs that I had heard of when I began practice, today is obsolete and buried years back. Again something else came up, again one drug, everyone, the whole world count, that has gone down the drain, something else has come. So this is a continuous procedure in allopathy, which you can understand is futile, because basically it's a cause and effect theory. And the allopaths run behind the effect. Even today, if you look at the research they do, it's all how to control the effect, but nothing about correcting the cause. As to what causes hypertension? Why did this patient get into blood pressure? Why did this patient get into blockages? Why did he go into for arteriosclerosis? Why did he go in for certain cardiac changes? So that is where homeopathy comes in. And as each day goes by, our scope in such cases on the increase. How much is your knowledge about miasms? All of you are well versed in miasms. What is a basic miasm in hypertension? Psychotic. If you look at Robert's philosophy, he gives it more as sora and syphilis. He calls it the tubercular miasm, which is a combination of more syphilis, less sora. Because sora you cannot deny is there in all cases. But when this gets coupled with syphilis, you have a miasm that can be responsible for hypertension. When we get the complications of hypertension, like arteriosclerosis, or which cause hypertension, certain calcareal plaques in the arteries, triple vessel disease, which is very common nowadays when these doctors advise bypass surgery. This is where the psychotic miasm comes in. So then you have a combination of psychosis and syphilis, and this is where the treatment and management becomes so difficult. And if you have along with this a strong family history of cardiac disease, a strong family history of bypass surgeries, heart attacks, hypertension, these cases get difficult to manage because the miasm is inherited. It's not an acquired miasm. You will find many families having a strong history of heart disease. So your remedy you choose or your line of approach must be deeply anti-miasmatic. If you go superficially, you may relieve the patient, but you will not really be able to correct the consequences of the inherited miasm. Here the basic classification of hypertension, what they call essential hypertension and secondary hypertension. Essential hypertension is more sora and psychosis. Secondary hypertension is usually syphilitic. When is our scope in homeopathy good in hypertension? In which cases? If there is no much of pathology, if the hypertension is more functional, I lose my temper, somebody has not come in time, my staff have misbehaved, I get angry, my pressure goes up, 10-15 minutes I cool down. No, this is very functional. This is more where you have soda. And here our scope is good because there is no underlying pathology. When you have got underlying pathology, our scope gets limited. Also, when you manage these cases, let us not take the risk of stopping the drug antihypertensive immediately. Many homeopaths do that mistake. If you stop antihypertensive immediately, the patient is going to react. So it's always better that you start homeopathy, see how the patient's response go, and then gradually taper down the allopathy. In some cases, it may take 3 months, 6 months, year and a half, depending upon how strong is the hypertension, how strong is the miasmatic background, and how is the responding to your treatment, and how constitutional your treatment is. Any of you have any experience with this mother tinctures in hypertension? Which mother tinctures there's Rolfia serpentina, there's a drug called Viscom album, there is another drug called Strophanthus.
Your experience has been good with mother tinctures?
I have been using mother tinctures over the last 7-8 years along with the constitutional treatment, and I found excellent results. When we are able to keep the pressure under control and gradually taper down allopathy altogether. Viscom album given in tincture doses, 20 drops twice a day, over the course of 2 months, 3 months, there will be absolutely no side effects. You will also find the patient responding to the remedy better, and later on, after some time, if the pressure still remains at 130 by 80, 120 by 80, you can discontinue Viscom album. We have also got certain cardiac tonics. One is called Diacard, made by this German remedies, a company called Adelmar. Then you have got one called Tonicard, made by SBL. And you have got one more called Essentia Aurea, gold drops, made by Wilma Schwab. This also I have used